assistant lecturer, Navodaya College of Physiotherapy. Today I am going to speak about Bell's palsy and its physiotherapy management. Now let's talk about the definition of Bell's palsy. Bell's palsy is a condition that is characterized by the acute paralysis or temporary weakness of the muscles of one side of the face. It is mainly characterized by the inflammation and swelling of the facial nerve within the facial canal or at the stylomastoid foramen. Bell's palsy is a lower motor neuron lesion. Now let's see the causes of Bell's palsy. The exact cause of Bell's palsy is yet unknown, but the things which contribute to Bell's palsy are viral infection of the herpes zoster virus and the herpes simplex virus. The other reason which contributes to Bell's palsy are vasospasm, allergies and polyneuritis cranialis. Now coming to the pathophysiology, let's see how vasospasm causes Bell's palsy. Whenever there is vasospasm, it leads to the primary ischemia of the nerves and the vessels there, which in turn leads to the edema of the surrounding tissue that leads to the compression of the nerves and vessels, which in turn causes the secondary ischemia, which leads to the facial nerve palsy at the lower motor neuron lesion, leading to the facial nerve paralysis. Now let's talk about the clinical features of Bell's palsy. As I said before, Bell's palsy causes the paralysis of the muscles of one side of the face. The clinical features are absence of the nasolabial fold, drooping of eyelid, drooping of the corners of the mouth, dryness of the eye and the mouth, loss of taste sensation and hypersensitivity to loud noise. Now let's talk about the diagnosis of Bell's palsy. The main diagnosis which we are going through are physical examination, neurological examination, MRI and CT. Now let me speak about Bell's phenomenon. Bell's phenomenon is an important characteristics as well as a diagnostic tool for Bell's palsy. What happens in Bell's phenomenon is that whenever we are trying to close the eyelid of a patient with Bell's palsy, the eyeball of the affected side will roll upwards, and this is known as Bell's phenomenon. Now let's discuss about the differential diagnosis of Bell's palsy. The conditions which have to be ruled out are Ramsay-Hunt syndrome, middle ear diseases, intracanalicular seventh nerve neuroma and diabetic mononeuropathy. Let's speak about the treatment part of Bell's palsy. Coming to the medical management, whenever a patient with Bell's palsy is there, we will be giving them prednisolone, acyclovir and vitamin B supplements. Surgical management of Bell's palsy is done only if the recovery doesn't take place after 2 months. In case of surgical treatment, surgical decompression as well as plastic surgery is done mainly to maintain the normal muscle symmetry. Now let's move on to the PT management of Bell's palsy. The main aims are reduce the inflammation in acute stages, eye care, maintain normal muscle symmetry, to re-educate the re-innervated nerves, to maintain the normal physiology of the denervated muscles and strengthening of the weaker muscles. The first and the foremost aim of the PT management in Bell's palsy are to reduce the inflammation in acute stages. Whenever there is no infective etiology, in this case, we can go for electrotherapeutic modalities like SWD and IRR. Proper care should be taken when treatment is given along with SWD and IRR. The next aim is the eye care and to maintain the normal muscle symmetry. Adhesive tapes, pads and goggles can be used to cover the eye. And to maintain the normal symmetry of the muscle, taping can be used. Now coming to the next aim, it is to maintain the normal physiology of the denervated muscle. Interrupted galvanic current with a sufficient intensity and with a pulse width of 300 meter per second and a frequency of 1 second is mainly given. A minimum of 90 contraction has to be given in each set of the treatment. Now let's see how to re-educate the re-innervated muscle. Firstly, pharynx stimulation of the facial nerve trunk is given. Now the patient is taught the facial exercises. The facial exercises are raising the eyebrow, frowning the eyebrow, closing the eye and blowing the air. The last aim of this treatment is mainly to strengthen the weakened muscle. Once good active movements are achieved, electrical stimulations are then stopped and facial exercises are done with resistance. The other techniques which we use to improve the strength of these weakened muscles are PNF exercises, cupboard rehabilitation and facial massage. Thank you.